The heart is a fascinating organ. It really is what drives the human body. It's the engine of the human body, the way it works, what it does, how it pumps the blood into all the vital organs, and without the heart, you really don't have the vitality that the body needs. And I think, to me, that was fascinating. Congenital heart disease is malformations of the heart that a child is born with. There's over 95% survival now for children with congenital heart disease. Doesn't matter the complexity, be it mild, moderate, or severe, there's a 95% chance of that child surviving, which means there's a 95% chance of that child becoming an adult. What changes between a child and an adult? The heart is now changing. The heart's now not that of a child, it's that of an adult. But you also have the layers that adult medicine brings with it, which can be heart failure, it could be arrhythmias. You're also dealing with liver disease, liver failure, kidney disease, lung disease. All this in an adult patient then gives rise to the field of adult congenital heart disease. The number of physicians who are trained and are taking care of these patients are maybe a few hundred in the country. And these patients get lost in the system. They don't know who they should see. That process of transition is very, very important. Transition means that we're going to work with a young adolescent, a teenager, to then move into the world of adult medicine in the next 4, 5, 6 years. And we ready them in this transition process to then become a patient in adult congenital heart disease. These patients have lived in the world of pediatrics. They haven't lived in adult medicine. They haven't worked with adult cardiologists. And at Mount Sinai, you have a children's heart center and you have Mount Sinai Heart. So the bridge exists. We have a dedicated transition team that includes a nurse practitioner, a nurse, a social worker. We have a whole team that works with these young families and say, well, in 5 years, this is what you're going to need. And that is the process of transition. That is the process of readiness.